This has been an incredible conversation on cell and gene therapy, one of the most cutting-edge areas of all of clinical medicine. And I think we can learn a lot from individual experiences. We tend to talk in the lexicon of clinical medicine about level 1, 2, and 3 evidence, and it's become this sort of dogma that we can only do things with evidence, and the evidence is categorized in this artificial framework of level 1, 2, and 3. 1 is defined as a randomized controlled trial. Well, that is true. Level 1 is better than 2, and 2 is better than 3. And we want to do things where evidence exists, and we want to pursue the creation of new evidence. But 60% of clinical decisions are purely discretionary where no evidence exists. And we can learn from individual cases. We can learn from individual cases. Some of my former colleagues described a case of stage 4 glioblastoma multiforme, generally considered to be incurable, as you know. And there was a case of a long-term survivor. Now, when somebody survives long-term, sometimes we think they were misdiagnosed, the pathology was read incorrectly. But this original pathology diagnosis was re-reviewed every year in a clinical conference, and it was stage 4 GBM. Why was that individual a long-term survivor? Can we ask these big questions that don't fit the model of an RCT? It turns out, it's interesting, that patient had a resection of the tumor and then an infection of the resection bed, and the abscess in the brain led the surgeons at the time to do the standard of care, which was to remove the skull plate, drain the infection surgically, and then remove in a second stage procedure down the road the skull plate. What happened? Maybe something happened. Maybe the bacteria activated an immune response. Maybe the bacteria had some endotoxin that chewed away at the tentacles of the remaining tumor in the resection bed. We don't know, but we can learn from individuals. And you saw that we took action immediately on banning 9 petroleum-based food dyes from the U.S. food supply. Well, we can, yes, read the randomized controlled trial on petroleum-based food dyes in Lancet, but we can also listen to individual families who say that they have had a kid with aggressive behavior, and when they stopped all the petroleum-based food dyes, single elimination of just food dyes, the kid's behavior then became normal. And then when they regressed, it was because they were reintroduced a year down the road. When you have a story like that, when you have an adverse event that is ignited seconds after the administration of something new in a young, healthy individual, that's causal until proven otherwise. We can learn from individuals. So I think that is the approach we need to take with cell and gene therapy.